All right. Hi, good morning, everyone. Welcome. We are so glad that you are here today, and we will get started in just a minute. I have a couple items to review first. We walk you through the tools in this session. I'd like to draw attention to the vertical bar featuring several icons on the right side of your screen. If your event feed is open, it's going to be hiding your vertical bar. So click the X in the upper right-hand corner of the event feed. Once you've closed your event feed, you'll be able to see a vertical bar with several icons. You'll see speech squares. That's the chat box for this session. The QA icon. Please use this to ask the presenter questions. You may also vote for questions. You can upvote on that'll bump them up in priority. If you're interested in hearing the answer to a question, next there's an icon of people indicating the participants in the session. And lastly, you'll see two papers stacked on top of one another, and that's all the resources for this presentation and the slide deck. We've got a couple of things in that, so check them out. To enable us to keep up with the questions, we ask that you please only use the Q&A icon to share your questions with the speakers, and feel free to upvote those. Again, that's the third icon from the top. And if at any time during a session you need to step away, take a break, debrief, decompress, please feel free to do so. We have a wellness room. You can enter that by clicking on the wellness room button in the top left side of the event navigation bar. So now I am so pleased to present our speakers for this session. We have Avelina Padin is a clinical health psychologist and assistant professor in the Department of Psychiatry and Behavioral Sciences at Rush University Medical Center. Dr. Padin has clinical and research experience in the areas of perinatal mental health and psychological trauma. Currently, she serves as project director for the Bridges program, a grant-funded effort to improve system of care for families of young children impacted by trauma on the west side of Chicago. And then we have Ms. Charlene Campbell. She's the vice president of Power Pack Illinois and a member of Community Organizing and Family Issues, a partner in the Bridges system of care work. She serves as a nurse at Northwestern Hospital in labor and delivery and has helped welcome babies into the world for 25 years. Christine Brambilla is the Senior Program Officer of Mental Health at the Illinois Children's Healthcare Foundation. And Tamara Fuller is the director of the Children and Family Research Center at the School of Social Work at the University of Illinois at Urbana-Champaign. Dr. Fuller is the PI of the evaluation of the Children's Mental Health Initiative, CMHI grant, which is examining the implementation and impact of funding to implement systems of care in 10 communities throughout the state of Illinois. Thank you so much again for being here, everyone, and the stage is yours, Avelina.
Thank you so much, Karina. Okay, I'm going to go ahead and share my screen here so that I can pull up our slides. Good morning, everybody. I'm seeing your good mornings in the chat. It's so great to be with you all today. We're going to be presenting some of our work, which is really a collaborative effort, you can see just from our speakers here, across lots of different organizations and entities. And we're going to be presenting on family engagement and leadership in a children's mental health system of care initiative. So just to give you a little overview of what we'll be talking about today. So we'll have Christine from the Illinois Children's Healthcare Foundation, who's going to provide a brief overview of their Children's Mental Health Initiative, which is the funding source for our system of care project, Bridges. Dr. Fuller, the PI of the evaluation, will discuss the data collection methods related to parent engagement and leadership in those CMHI project sites and present some of their findings related to what makes folks successful with parent engagement in their systems of care. And then myself and Ms. Campbell will talk a little bit about one of those CMHI projects, Bridges, and describe our efforts to include parents in their system of care implementation activities. So we have a couple of opportunities for polls throughout this presentation, and we're going to be using something called Slido. So what I will ask is, if you're out there listening, if you can either scan this QR code, or you can go to slido.com and enter the number that you see on your screen. And we want to know a little bit about who's in the room with us. We'd like to know, what is your role in working with children and families, or what is your role in working with systems of care? So go ahead and scan that QR code, or join at slido.com, and you can tell us a little bit about what your role is like, so we can learn who's in our room with us. All right, look at this. This is great. So I see answers coming in already. Kinship home study specialist. We have a system of care coordinator, a couple of clinicians, mental health clinicians, psychiatrist, family support specialist. Great. Parent support specialist, family coordinator, system of care management, family services and supports, past teacher. Oh, great. Mental health liaisons, policy analyst. What a great diversity of folks we have in this room with us. Lead family support, someone who works in an emergency department. Wonderful. A lot of family coordinators, family service coordinators. Okay, wonderful. So one thing I'm seeing from, all of these responses is just how many of you work really closely with families. And we really believe in, as we're developing services and supports for families, really engaging families in the development of those supports. And so a lot of what we'll be talking about today, I hope, will be really valuable for those of you who are hoping to really involve families and engage them in trying to identify what types of services and supports are going to be most helpful to them. So I'm going to keep us going. We'll have other opportunities for polls here along the way, and I'm going to turn it over to Christine, who is going to share with us a little bit about the background of the CMHI project.
Good morning, everyone. I am honored to be here to co-present with our community partners, Bridges, Kofi, and University of Illinois. At the Illinois Children's Healthcare Foundation, we cultivate, support, and promote initiatives that improve the health and wellness of children and families in Illinois. The Children's Mental Health Initiative is an example of that work. On the map to your left, you'll see various locations of our CMHI cohorts. Starting in 2009, CMHI 1.0 is the teal counties that you see highlighted in the map, and there were 4 partners in that cohort. CMHI 2.0 is indicated by the green counties that you'll see. So there are 4 grantees, part of that cohort. And then CMHI 3.0, which Bridges and Kofi are a member of, are indicated by the rustic orange color, and there are 5 community partners in there. As you can see, we are a statewide foundation, and we try to intentionally partner with communities across the state of Illinois to ensure that we are being equitable with our funding and thinking about the cross-systems change that can happen across our great state of Illinois. We also fund a cohort model in order to cultivate a shared learning environment in which partners can learn from one another, share their successes and challenges, and in some cases, collaborate to host events. ILCHF has hosted events in which participants in various cohorts can connect in person, virtually, to network and bridge the work across communities and learn about how they've been able to cultivate partnerships across systems and troubleshoot and think about tackling the behavioral health workforce challenges that is not uncommon in Illinois and across our state. The next 2 slides focus on the CMHI, the 11 CMHI outcomes that we are measuring as part of our grant agreement, and that progress across our various CMHI cohorts. These are the same 11 CMHI outcomes that we're measuring across the 2.0 cohort as well as the 3.0 cohort. And first and foremost, we really want to get upstream, and early identification is how we can be proactive to support the early identification of children and youth so that they can proactively access services before they may need a higher standard of care. The next item that we're focusing on is the increased capacity of the behavioral health workforce. As I alluded to, this continues to be a challenge, and I know it's something that you all are experiencing on your end. And we have learned some creative solutions as to how partners have been able to approach thinking about the continuum of the behavioral health workforce and how they've been able to recruit community partners like Kofi to think about how they can bridge those gaps in our behavioral health workforce, but really bridging those natural community partners. The next one that I would want to highlight is increased service integration. We are, after all, seeking to fund systems of care, and our goal is to really break down silos, to really think about how we can have a community-wide table. And you'll also see that with Avelina's remarks. And there is a very intentional effort in some of our CMHI partners to de-silo and to kind of get away from the fiscal entity, really think about cultivating a community-wide branding of the system of care that is de-identified from any one organization to really foster this community identity. The next slide will focus on outcomes that we're specifically tracking with the evaluation with University of Illinois that Tammy will get into a little bit later. And lastly, we want to honor the story and journey of each of our partners, and each CMHI partner creates a manual of implementation of their system of care work. This is almost like to document their journey, their roadmap, and you can access and view the manuals from the CMHI 1.0 cohort via the link at the bottom of the slide. So with that, I turn it over.
Okay, we have another poll that we would love for you to answer if you can. And we're interested in just finding out if your organization has ever collected data about family engagement in your system of care efforts, because I'm going to talk a little bit about the data that we've collected as part of the evaluation for the CMHI initiatives. So we just wanted to get a sense of if you've tried to do this, because it's not easy. It's a complex thing to gather data on. So it looks like about roughly half have collected some data on family engagement. Okay. We have a lot of information. I have a lot of information to tell you about our evaluation findings. So if we could go to okay, there we go. So the foundation hired the Children and Family Research Center, so my organization, to design and conduct a program evaluation of the Children's Mental Health Initiative. And we're doing the evaluation of the 2.0 and the 3.0 sites. We did not do the evaluation of the 1.0 sites. So there's 10 sites in the 2.0 and 3.0 cohorts. And the goals of this evaluation are really to examine the processes and the strategies that each of the sites are using to implement the system of care in their communities. And the second goal is to monitor the progress of each site in achieving those 11 outcome goals that Christine just mentioned. One of those goals is parent and youth engagement, and it is a core value in all systems of care. And it is reflected in the requirements of the grants. So the grantees are required to attempt to engage parents and youth in their system of care implementation efforts. Okay. So how did we go about evaluating parent engagement in these system of care? Like I mentioned before, engagement is a really complex phenomenon, and it's important to gather data from multiple perspectives. So we approached this in several different ways in our evaluation. The first is that we did site visits in each of the 10 sites. So what that included was we did a lot of focus groups and a lot of interviews. So we collected qualitative data about a number of different things, and they focused primarily on how implementation was going. So how were sites working to implement systems of care in their community? So that was the site visit. We also had an annual stakeholder survey that collects quantitative data on a variety of things. And one of the things that it asks about is parent and youth engagement in the implementation of systems of care. And then the third data collection method that we use to look at parent engagement is a longitudinal caregiver survey. And so this is a survey that parents who have children who are receiving services through the system of care in the communities complete. And they complete it at 6 different points over time. And it asks about a lot of different things. But one of the things that it asks them about is whether they were engaged in the process of service delivery. So not really the implementation of systems of care, but whether they were engaged in the services that their children were receiving. So obviously I'm a little bit limited in the amount of time that I can talk about the evaluation findings related to parent engagement. So I'm going to focus mostly on the qualitative data that we collected through the site visits. But if you want to learn more, if you want to see actual copies of the surveys that we use, the longitudinal caregiver survey or the stakeholder survey, I put a link in the slides to our website. You can go look at all the reports. They have the surveys in there. They have the interview and focus group questions. You can read till your heart's content. So I'm just going to, I know I said I was going to focus on the qualitative data, but I just wanted to give you one example of how we measured parent engagement in the annual stakeholder survey. So there's a question on the survey that said, please rate the extent to which the following implementation activities or supports are present in your community right now. And the question is, parent caregiver involvement in the system of care implementation. And then the response options for this question were not at all in place, partially in place, and don't know. And so this slide shows the results for one of the 3.0 sites, and it shows the results over time. So the first bar is what the results were in 2021. The middle one were in 2022, and the one on the right is 2023. So you can see how implementation of efforts into involving parents have evolved over time. So if you look at the yellow part of the bar, that shows the percentage of the survey respondents who thought that parent involvement was fully in place. And you can see that this has increased over time from about 41% in 2021 to 71% in 2023. So that's a very positive finding for this particular site. Okay. Now on to the site visit results. So we did interviews and focus groups with parents and youth, with project staff, and with service providers, basically anyone who is involved in implementing the system of care in that community. We invited them to participate in the focus groups. So I'm going to focus on the 3.0 site visits. These were conducted between October 2022 and January 2023, which would have been about 2 years after the start of the funding for the 3.0 sites. And we interviewed or included in the focus group 56 individuals, including 10 parents. So this is the question that we asked in the focus groups related to parent engagement. So we asked, considering your experiences and observations as part of the team, how have youth and parents or caregivers been involved in system planning and building? How have parents been prepared and supported to play a leadership role in implementation? What efforts have been made to be inclusive and reflect the diversity of the community? What has been challenging getting families and youth involved? What has been successful? And then how can parents and youth be involved going forward? Now, obviously, we didn't ask all these questions at one time, but these were the prompts that we used to gather information and perceptions from the people who were involved in the focus groups. And then we recorded and transcribed the focus groups, and then we analyzed the data. And what we wound up finding was that these were the strategies that sites used to successfully engage parents. But actually, overall, the findings from the 3.0 site visits revealed really that only one of the 5 sites had any sort of success in engaging parents in the process of system of care implementation at that point. And keep in mind that at this point, it had been about 2 years after the funding had started. So what we learned was that engaging parents in the implementation activities is difficult, and that successful efforts to do so need to be intentional and should start right at the beginning of the project. You don't want to wait until a year or 2 down the road to start trying to involve parents. And there are some things, so the site that was successful is Bridges, and you're going to hear a bit more from Avelina and Charlene about some of their successful strategies. But these, the things that I'm going to tell you about are some of the things that we found from the site visit data. And what I'm going to do is talk about each of these and give you a quote from the site visits. Okay. So the first, next slide, please. Okay, so the first strategy that was successful is engaging parents early. So I'm going to give examples about Bridges here. So Bridges actually applied for funding in the 2.0 from the 2.0 cohort, and they did not receive funding at that particular time. So what they did during the interim year before they applied for funding again with the 3.0 cohort was that they were very intentional in their efforts at community outreach, at involving parents in the planning process, and then co-creating a new proposal. They also brought an organization called Kofi in as a full partner on the second funding application. And again, you'll hear more about this from Avelina and Charlene. And then a capstone of the collaborative visioning process was Design Day, where community members and early childhood providers came together and really visioned what they wanted the project to look like. So here's the quote. During Design Day, we had a couple of our parents participate, and that really fueled the energy back in terms of parents and their commitment to this work. So it was a pretty successful event in terms of bringing in community members to brainstorm and vision together. I think it was pretty powerful for our parents. Some really great questions were posed to the group, like, what's going to happen in 20 years from now if we do nothing different than what we're doing today? And how do we get there? Okay, next slide. The next thing that Bridges did that really added to their success in engaging parents is provide training to the parents to help them participate more actively. So several parents and other stakeholders mentioned the importance of the Kofi training that was provided to parents and the entire leadership team. And again, you'll probably hear a bit more about this Kofi training, but it's a 3-tiered training model that unfolds over the course of months and provides tools, strategies, and supports for parents to become more empowered to impact their own lives and their community. The quote, parents that we have participating right now in the community planning team are at various levels of leadership, but almost all of them have been around for some time and so have had the benefit of going through all 3 phases of the COFI training, and then also had the experience of sitting with legislators or talking to the media and telling their story. And so the idea is, the word movement is that there's more parents out there, not just the 7 or 8 that are part of this right now. There's a lot more parents out there who maybe don't view themselves as leaders, but have a lot of insight into how the system is working or not working. And the more leadership we build, the louder that voice will be in terms of coming up with solutions. Okay. Equitable compensation. This was something that was mentioned by almost all of the parents in each of the 5 sites. If you want parents and youth as well to be meaningfully and consistently engaged, there must be equitable compensation that demonstrates the value of their time, contributions, and expertise. So one of the parents said, a majority of our population is struggling, and I think one of the first things is prioritizing some sort of reimbursement of time, or let's provide some childcare, or let's make sure that your needs are being met when you're lending your time and expertise to us for this community event. It is an extraordinary amount of time and money to parent a child with mental health needs. Okay, next slide. Meeting accommodations and supports. Given the diverse background of parents and youth with lived experience, agencies really need to be flexible with meeting times and locations, access to technology, childcare, and transportation. Interpretation assistance may also increase engagement of diverse voices. And Bridges specifically employed a debriefing meetings with parents after the larger community planning team meetings that allowed parents to provide feedback. So here's a quote that talks about that. Every time we have a community planning team meeting, we have a debrief meeting the following week, where we meet with a couple people from the leadership team, at least 1 or 2 parents who attended that meeting, as well as some of the COFI staff members who are not part of the leadership team. During the debriefing meeting, we will take the time to collate the information that comes from the meeting. Let's say we had a sit down where we talked about the waiting list thing. We tried to take notes during those meetings. The debrief meeting is a space to come back together and say, what did you hear? We'll make sure we got it all. The group really spends time thinking about, okay, what are the programmatic implications of this conversation that we've had? We'll spend some time thinking about what might be some good ideas to come from that meeting. And I will take that back to the leadership team and say, here are some things that we've distilled. What do you think about this? That way, the parent voice is not just involved in the initial brainstorming process, but also the program development piece as well. Okay. Respect versus tokenism. Respect for parents and youth involves valuing their skill sets and leadership abilities beyond their lived experience. Parents and youth should be treated as equal partners by incorporating their perspectives into decision-making practices, including budget and other programmatic decisions. It's also important to provide parents and youth with professional development opportunities, such as speaking engagement, conference presentations, authorship credits, and acknowledgement in written products. Here's a quote about respect versus tokenism. One parent in one site spoke about the lack of inclusion in decision-making, and she said, yeah, because that's not a real way for, they don't ask me to weigh in on anything. They ask me to do outreach for their events, but I feel like that's not my job. I don't do outreach. Laughs. I don't pass out flyers. But still, I feel like there's a better use of my knowledge of the community and who's in the community, but I think it does lack the effort to really integrate families into their decision-making in their system. There are things that are happening, and I think they are in the best interest of families, but it's not transparent. And so it's not the way that should happen, in my opinion. Okay, I think that's the last one for me. All right.
Yeah. Thanks, Tammy. So I'm going to take over from here and just kind of back us up a little bit and provide a little bit of background about the Bridges system of care specifically, which is one of those CMHI 3.0 cohort sites that was funded by the Illinois Children's Healthcare Foundation. And myself and Ms. Campbell, I'll provide some background about Bridges, and then Ms. Campbell is going to share some of her experience as one of our parent leaders, who is a really strong member of our parent team from Community Organizing and Family Issues, or COFI, who partner with us on this grant. So Bridges is a partnership between Rush University Medical Center and COFI. And we are primarily interested in working to improve systems of care for families who live on the west side of Chicago. So you can see the map of the different neighborhoods that we are focused on in the Chicago area, if you're at all familiar with Chicago. And then all of our partner sites are kind of underneath that map. So you can see that we work with a large number of partners that include home visiting and doula agencies, community-based mental health organizations, and policy and advocacy leaders in the Chicago area. And Bridges is really focused on building systems that work for families with young children, prenatal through age 5, who are experiencing difficulties related to traumatic stress.
How you doing?
Recognizing that our systems work for some families, but not all. And so we're really invested in understanding why, and then working collaboratively to create systems change grounded by principles that are family-centered and trauma-informed. So as a group, we collectively identified 4 real primary areas that we're focused on building in order to help families heal from trauma and build resilience. And so that includes linking families to services that help them to build supportive relationships, seeking and implementing interventions that help families heal, connecting families to support for social needs, and addressing and removing barriers to care. And we really, as Tammy and Christine already mentioned, really a backbone foundation of Bridges is family leadership and engagement in our system of care, recognizing that we really need a strong collaborative network of parents and providers who can bring their shared expertise together in one room in order to generate effective system care. We recognize that when change is generated from academic institutions or large organizations, we're really missing a critical voice from parents, caregivers, families, youth, in being able to develop something that's actually going to work for families. So when we think about parent involvement in Bridges, I sort of think about this as fitting into 3 buckets. We think a lot and have thought a lot about how parents can be best prepared, how caregivers can be best prepared to be able to be involved and be leaders in a system of care. So we have a lot of ways in which COFI does a really great job of preparing parents. And then we also think about our parents as partners in our work. So we have a number of ways that Tammy actually already touched on that we really try to engage parents as partners. And then also we've thought a lot about how parents and caregivers can really serve as healers in their communities. And so leveraging their expertise that they're already bringing to their family systems, to their neighbors, to their communities, and leveraging that expertise with some of the evidence-based practices that we know work for families, and combining that to have parents serve as healers. So I'm going to invite Ms. Campbell to talk a little bit, maybe starting Ms. Campbell with just sort of what the COFI Way training is and how you feel COFI prepared you to engage with the Bridges system of care work.
Hello, everybody. Can you all hear me?
Yep, we can hear you.
Okay. My name is Charlene Campbell. I am one of the parent leaders at COFI. I've been involved with them for about 17 years or so. And some kind of way I've worked my way up there. Now I'm the vice president. That sounds so weird to say. I'm the vice parent of Power Pack. So COFI, as you've been hearing our name, is an organization, community to organize family issues. Kofi is an organization, but for me, it's been an experience of personal change and transformation. And I say that because from the years that I've been involved, that people have seen me grow. And now that I've been in it, I've seen other parents grow. It's really, really interesting when you see a person, a parent, going from their everyday existence to exist in their best way possible to suddenly realizing that I got a voice, I got some power, and I got some skills. Now I still am. I'm a mom of seven. So when Kofi came and was passing out flyers at my school, I wasn't in a place of saying I was a parent leader, that I had some power. I was more or less on survival mode of every day. I had a child that was just starting developing bipolar but hadn't been diagnosed yet. And then I had another child that was ADHD, which was borderline autism. And then I had three girls that was supposedly gifted. So I'm figuring out, where the heck do I fit in the midst of all this mess? So when Kofi came in and they're sitting down and they're talking, I was one of those parents that would sit in the back, fold my arms. I didn't heard it all before. They're not going to tell me anything other than count to 10, go take a bath, have a good day. But it had to be something in me to start with, that I still sat in the meeting and they caught my attention in what they were saying. So it was a two-part partnership that developed. And that's where you get your parents in saying something that's going to trigger them. The Kofi model helps parents develop tools that unearth and discover that they have personal strength. With seven children, these are words I would not have thought about as far as personal strength. Under the umbrella of Kofi, the parents that have developed, we develop Power Pack. We are the parents. Power Pack is Parents Organized to Win, Educate, and Renew Policy Action Council. We merge with Bridges because Bridges seen something in us that we were doing with parents developing and growing. Again, I go back to that Mama 7. That model helped me develop and speak more about my skills and what I could do for my family. In this little thing that we're doing, you heard the word engagement. Engagement can mean a lot of things. When I would be doing my holiday cooking, I would engage my 2-year-old. He made toast. So I might be making gumbo, I might be cooking turkey, but his role was toast. That was his engagement part, to be a part of the family, contribute, and he could feel a part. That's what Kofi does. It gives you a tools to feel respected and feel a part, that you're being heard. We have parents cross cultures. We have parents that don't even speak English. We got low income parents, no income parents. Parents that don't have high school diplomas. Some might be trying to work on college. We have moms, dads, grandparents, parents from everything, but are working for the same goal. We want to do better in our community, and we want to do something for our families. Kofi gave us that avenue, that space to develop that. Right now, one of our parents, she doesn't speak English, but I've learned in one of our tools that she likes rock and roll music. So when we do an outreach, I'm playing some rock and roll music, and she knows I am trying to communicate with her in some type of way. Now, I'm saying this, but it doesn't happen overnight. Kofi has 3 phases. Self, family, and teams is the first part. They have embraced that age-old thing that you heard. You got to save yourself first before you save anybody else. That's self, family, and teams. You start with self. You start to make goals. When they ask me what was a goal, I'm like, a goal? I just want to be able to get breakfast and get them out the house and go to school. That's my goal. And maybe get both shoes on the same color. So then I had to think about myself. You know how hard that is if you've never done it before? So you just kind of come up with stuff, but throughout the process, you learn you are a vital member to your family. And once you start going through stuff about yourself, then you are able to help your family. The second part of the phase is the community outreach. Okay, you learned about yourself, you made goals. One of my goals would be color-coded grandma. I'm getting there. I'm still working on that. That as you proceed, you can develop more. Once you got yourself together, you got your family together, and you building teams, that's when the second phase is. You start going out in the community. Some of our parents have put together and made a playground happen at their school. They made a stop sign in different. They went out into the community to do things. So I'm quite sure Bridget's looking at us with binoculars like, look at Kofi, look what they're doing. They can bring this to the table and help us. So when I watched you all sign in all your organizations where you were from, it made me think back when we first met with Bridges, and I'm like, wow, all these professional people, and I'm just a parent. I don't have nothing to contribute. But at the table, Bridges never made me feel like just a parent. We all came together. It wasn't that they was above, we was above. Everybody was putting together what could be the best thing for the communities that we wanted to serve. That I could recall saying, I'm not the data girl, and I'm so glad you all people that do like the numbers. I say that all the time. But they gave us the opportunity to pick and choose. Well, what do you feel comfortable with? Where would you like to put your voice that might be better? I would say sometimes you guys need to break it down, and they would. We come into the meeting, they would slow it down, talk to us. They wouldn't always use all these acronyms, and you'd be like, blah, 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 what you're talking about. That even though they were from a professional level, it was just like we were one of them and they were one of us. And I think that's what made us, the parents that got involved in Bridges, feel very comfortable in the participation, because it was just a bounce off of what we were doing, the same thing with Kofi. Now, one of the things I participated in, I'm gonna tell y'all, if y'all haven't done it, you should do it, is the Circle of Security. So the program is based for caregivers of young children. So at the time when I took it, all my kids are grown, 23 to 45, I think. I don't keep up with them ages. They grown now. But one thing I have to say is that each day is a different day. When you learn something and you really invest it, you come back to it and you can apply it. That circle of security is not just for caregivers of young children. That could be applied to anyone that you need to reach out to. You can apply it to some family taking care of an older person. You could apply it to someone that has diverse learners, because it's all about building relationships. Going back to the basic Kofi model, going back to how Bridges made us feel. I even remember saying, oh my God, I'm so surprised the FBI didn't come and lock me up, considering how I was doing what I had learned from my parents, that I was just doing what I knew. Now I'm learning a different way to apply those things that you can always go back to. Now they had the narrative. I didn't take that, but the parents that did, they talked about it. I begged, I would be a fly on the wall. Let me sit in the chair in the corner. I want to do the net, but they already had their people they was going to choose. And from listening to them talk about it, is so fantastic in learning. So wait, let me say this. Mental health is real. We talk about mental health, we talk about how there are challenges, but I'm going to say to you all on this line here, every day could be something different. because every day is a different day. Your day yesterday was great. You got up, got your coffee, got ready for work, everything matched. But today, the car might not have started. And so now that takes you off your square. When we learn to build these relationships that we've built, that we learn that you have your support system. We reach out to the professionals of bridges. If like one of our parents has just had a young child, I think Corey's 3 or 4 now, and she's always asking questions. What do I do? Corey's doing this, Corey's doing that. And I'd be like, oh, I'm so glad I'm past that early stage. And it's so ironic. I have been so deeply involved in early learning. That was our initial connection for our outreach. And if you think about it, everything we do as humans start at early, even animals start early intervention, teaching. But you need to have patience and you need to understand and pay attention. Are you really connecting? Are you out there getting involved? When we do outreach on early interventions, there are parents still out there that don't realize their kids should be in school somewhere. If you're not a good teacher, if you're not a good encourager, there are people that can help. So you should have your child in school. When we're doing our outreach, we pass that information on. We've done outreach on early learning. We've done outreach in peer-to-peer on IEPs, where children need to get those extra services. We went out in the community to find out what was the problem, what was happening, why they couldn't get to a doctor. The zip code was wrong. It wasn't taking their insurance. So some of the things that was mentioned here in the data, we've done outreach to bring that information back. Now, when I first got in Kofi, as I said, because I had 7 kids, I went straight for the restorative justice because I figured I need restorative myself. I need some help. So I've always been in the elementary justice, but some kind of way, the early learning just kind of slid in there. And so I'm working and doing that. If you ever think, if you're in a meeting and somebody is opposing you, it's not a negative thing. It should make you think, how is that opposition can work for the betterment of the meeting? Because in the Kofi model, people say it's a mind change, but it's not just a mind change. It's a mind change, it's a heart change, and it's emotion change. Because when you are doing something different, your body kind of takes you out yourself, and you might have some emotional feelings about how you're feeling. And those feelings might not be in the betterment, but once you sit back and reflect, you needed to go through that process to get unstuck. And I'm telling you all, some of y'all on this line, some of y'all are parents, y'all get stuck because your kids, oh, and God knows if you got teenagers. That's a whole process. That's a whole livelihood in itself that you need to step back and think. I so think back that we need to regroup. The restorative justice process, I've taken that training maybe 3 times because as I grow, I'm not the same person I was last year. So as I'm growing, I'm learning different things. I'm being at different emotional states. And so I have to regroup myself to get in a different place. And that the surroundment of from what we get from bridges, from what we get with each other parents, I can call somebody and like, listen, I had a moment this morning, y'all. I'm gonna be, they say truth and honest, that I was supposed to go in the office and the office is closed. I'm like, I'm not technically inclined. I tell everybody that. Now the office is closed. What am I going to do? How am I going to get in this call? I got to call on my support people. That took me into an emotional, mental state. Every day is a different day. But I had to step back, slow down, regroup, call on my support system to come help me that I can do this. I'm sorry. When I get to talking about Kofi, I can go on and on. So I
No,
told you
you're fine, Miss Campbell. I want to thank you so much for being here and for sharing about your involvement with Bridges and your experiences with Kofi. And I just want to make sure we have a little bit of time to share with this group, and then we'll open up for Q&A. That, if you're interested in learning more about how to engage parents in your system of care work, or really at any table that you're a part of that you think would benefit from parent engagement, involvement, and leadership, Kofi created this really, really cool report that came out a little bit earlier this year that outlines their recommendations for how to engage parents in leadership and bring them to the table to work on issues and policies for family and children. And it's just a really powerful report. We also shared it as one of our resources for this presentation. So you can either find it there or use this QR code to read a little bit more about that report. And some of the takeaways that I'll just mention briefly are and these are things that Tammy also already mentioned as part of the data that they collected as part of the evaluation, but they've really identified the importance of sharing power. So including parents, like Charlene said, engaging them, helping them identify their role as leaders in your work. They talk about changing the culture. So making sure that you've created a structure that's inviting for parents and that you're willing to hear parents' feedback and maybe adjust how you've been doing things normally in order to have parent voice at the table. And then number 3, investing in parents, which we've already talked about. So providing resources so that parents can be engaged in your work, whether that's shifting around your meeting times to make sure that it doesn't interfere with kid pickup or drop off, making sure that you're compensating people adequately for their time, and giving them training and, yes, even technical support sometimes to make sure that they can be at the table, be in your space. So with that, I'm going to stop sharing my screen so that we can take a little bit of time for question and answer here. So feel free to drop any questions that you might have. Let me figure out how to stop sharing my screen here. There we go. And we'll kind of open it up to answer any questions that folks might have. I see that the QR code is not working in the chat. So this is something, the report for the Kofi report is something that we've included in the handouts for the session. So you should be able to access it that way too.
Evelina, we also had a question about parent compensation. Could you talk a little bit more about that?
Yeah, so we worked with Kofi to identify with their staff and with their parents to sort of identify a stipend that would work well for the parents based on the amount of time that we were asking them to show up to the table. And then also asking them about things like, what kinds of supports would you need to be engaged in our system of care? So, if you need childcare, if you need to take time off of work, if you need parking, gas, bus fare, all of that went into us coming up with a figure that made sense for the families that we're working with. So I think it's important when you're thinking about compensation to ask parents and caregivers what they need to make it work, instead of just kind of coming up with that figure in your own mind and saying this should be enough, right? So you got to ask, and you'll get a number, and you'll work with families to figure it out from there. Any other questions that we can answer?
And I'm not sure, Ms. Campbell, if you saw all the love in the chat. Everyone was incredibly grateful for you lending your story and for your leadership. So they just communicated lots of love in the chat.
I see a question about what time we have our system of care meetings. Again, I think asking the parents that you're working with is always helpful, but the parents that we work with were pretty clear that like mid-morning was really the best time for the majority of them. It avoided that kid drop-off time. But I've also heard other systems of care in our meetings, and Christine mentioned what's so powerful about the CMHI is that we're able to interact with the other systems of care and hear what they're doing across the state of Illinois. So I've heard people say that for their families, it works better to do it in the evenings. It might work better to do it on the weekends when people don't have work responsibilities. So I think, just asking the parents that you're working with what works best for them is really powerful. And I see another question about virtual versus in-person meetings. We've done a mix. I know that Kofi really sees a lot of value and power in the in-person meeting, and we agree with that face-to-face is just really powerful and lends to collaboration and relationship building. That being said, at 10 a.m. on a Tuesday, it can be really hard to get everybody in the same physical location at the same time. So we do have virtual meetings for our larger community planning team meetings because that allows the biggest number of people to be able to attend. But then we do have opportunities for that in-person connection throughout the year as well.
And there's another question. If organizations outside of the Chicago area, can they connect with Kofi to improve their programs and encourage parent involvement?
Ms. Campbell, can you speak to the reach of Kofi? Like, I know Kofi is outside of just the kind of west side of Chicago. Where else are they?
Can they say that again? I didn't hear it.
Yeah, so someone's wondering if organizations outside of just the Chicago area are able to connect with Kofi.
Girl, let me tell you. Okay, we started as Kofi. As the parents grew, we were Power Pack. Now we are Power Pack Illinois because we have reached out. We're in Elgin, Aurora, East St. Louis, and somebody else. What is Evanston? And so before we became Power Pack Illinois, people were saying, yeah, we need to go here, we need to go there. So right now, the theme is we're going to go worldwide.
I love it. That sounds like a resounding yes. Don't hesitate to reach out to Kofi if you want to connect, no matter where you are in the world.
And not only that, but Kofi in itself reaches out to other organizations. And so, like Dignity in Schools, that we have a collaborative with them. So our name is out there.
Thanks, Ms. Campbell. Well, we really want to thank everybody for their time and their attention this morning. It's been our pleasure to get to share some of our work with you all today.
Yeah, if we don't have any more questions. Oh, do we have? Nope, just another thank you. So I will close us out and say thank you to every single one of you for sharing your time, your experience, your expertise with us and the group today. We had around 120 attendees in our session today. It's pretty amazing. So thank each of you for being here. Our next session starts in about 30 minutes, and we'll hear from the keynote speaker, which is Dr. Tanisha Foster-Freeman. She'll be exploring the individual, interpersonal, and organizational factors contributing to mental health disparities among Black and Brown youth and young adults. Discover actionable steps to foster caring and equitable systems in collaboration with our communities, aiming to eliminate disparities and create meaningful change. Dr. Tanisha Freeman Foster is amazing, so y'all won't want to miss that. 30 minutes. We'll see you there. Thank you, everyone.
Thank you, everyone. Have a good day.